Nail fungus treatment. There is no shortage of nail fungus cures on the internet, products sold in drug stores, and in general dissemination of incorrect information. Treatment can be difficult because of the fact that nail fungus thrives in dark moist environments and happens to grow underneath the nail. Wearing closed shoes and socks all day with feet that perspire creates a perfect breeding ground for nail fungus. Eliminating those factors can go a long way to reducing recurrence. Oral medication for fungus nails. For years the gold standard for treating onychomycosis in an otherwise healthy individual has been oral therapy. The most widely prescribed medication today is Lamisil tablets, although there are certainly other oral antifungals that can be used. The newer generation of oral antifungals are fairly safe medications if properly used. Lamisil tablets has adverse response rate of less than 3%. Typically, the dosing for Lamisil is 1 tablet per day for 3 months for fungus nails. A dosing schedule known as pulse dosing has become popular. Instead of 90 days worth of Lamisil, the pulse dosing is a combination of days taking the medication and days not taking the medication. I have been using pulse dosing now for quite a while for nail fungus and am generally pleased with the results. The obvious advantage to this type of dosing is less adverse effects from the medication and overall cost. Your doctor may prescribe 1 or 2 blood tests during the course of therapy to make sure there are no adverse effects. As a side note, ever since I have started the pulse dosing regimen for oral Lamisil, I no longer do blood work. The logic here is that the medicine is not in your system long enough to cause any adverse effects. Additionally, your doctor should take a sampling of the nail and have it tested to confirm that it is true nail fungus. Visual inspection is not the proper way to make a diagnosis. Many times a thickened nail is nothing more than keratinization of the underlying nail bed, which is a thickening of the skin underneath, usually from repeated trauma. This can eventually lead to nail fungus because the increased thickened skin is a good focal point for fungus to enter. A thick discolored nail may also be a result of mold and spore infestation and have nothing to do with fungus. If your nail sampling does not contain the organisms that Lamisil kills, taking the medication is a waste of time. The other problem of not doing a nail sampling is that a few of the insurance companies out there will not pay for oral antifungals without proof of nail fungus. Topical medication for fungus nails. Although topical treatments are available, they tend to be less effective. The main problem, as stated earlier, is that fungus grows underneath the nail, so applying medication to the top of the nail becomes an effort and futility. Trying to force the medication underneath the nail rarely works. The best way to use topical medication is to see a foot specialist who will grind down and cut away as much of the diseased nail as possible, a painless procedure, so that the topical medication will penetrate to the live fungus more readily. This can become a tedious process as the medication generally has to be applied twice a day by the patient. Being lazy about it defeats the whole purpose, and then the nail has to be ground down on a regular basis. The other problem is that depending on the degree of fungus, this process can take upwards of a year. Another issue is that the greater the number of nails that are infected, the less the likelihood is of clearing them all up with the topical medication. Having said that, I have seen some very gratifying results with topical medication. Again, it is important to note that along with treating the nails for fungus, any fungal skin infection also needs to be treated. The other problem with most commercially available topical antifungal medications is that they are either of a water or alcohol base and neither ingredient penetrates nail, which is primarily protein and fat, not calcium. Oil-based topical antifungals are much better at penetrating the nail, which acts as a protective barrier, to get to the actual fungus. If you do not want to take oral medication or are not sure you even have true onychomycosis, then the topical medication is a very safe alternative. Keep in mind there can be failure using either topical or oral medication. But, here is an important point to take away from this, and that is if you only have a little fungus such as maybe on a nail or two, you are much better off trying to eradicate that rather than waiting, while the condition further worsens and then you are stuck trying to clear up a more severe case. A good rule of thumb is, the worse the fungus condition, the harder it is to clear up. A precursor to those thick yellow nails we have been discussing is a situation where you notice white specks on your nails. Many women will notice them when they remove nail polish. This is superficial nail fungus where the fungus is growing on top of the nail and without proper treatment may burrow through the nail and cause thickening and discoloration. People with this condition should treat their fungus immediately as it is fairly easy to remedy. Nail fungus laser treatment. The last option available for nail fungus is laser treatment. Laser became popular in the United States a few years ago, but until recently none of the available laser units were FDA approved. This has changed and as a result I have started performing laser surgery on fungus nails. Unlike either topical or oral medicine, Laser destroys all the different organisms that are growing underneath the nail. Studies are now available that are older than 1 year, and I have seen some very impressive results. I have personally found that people prefer laser surgery over other options because it is a safe, painless procedure with the highest rate of success. Laser is a painless procedure but is not covered by any insurance. Prices for this service will vary from one doctor to the next. Some doctors will only treat the nails that exhibit visible fungus, while others will treat all 10 nails, the idea being that some of the healthy-looking nails may actually have fungus in them and they will reinfect the other nails. With laser surgery or any other treatment therapy you undertake, it is important to note that the diseased nail itself does not change in appearance initially. What happens is the diseased nail goes from live fungus to dead fungus, but the appearance does not change. Over time, as the nail grows forward and the diseased nail is cut away, it is eventually replaced with healthy nail, which begins at the growth plate of the nail, which is the back portion of the nail.